Hi to everybody. Well, for me it's again a good pleasure to be here with you, sharing the thing that I'm doing here in my clinic, helping thousands of people who are dreaming for a beautiful smile and also dreaming for a nice and good health in their mouth and of course in their lives. This is a really complex case because, as you are going to see in the picture, this woman was treated a few years ago with orthodontics, where in the treatment before someone did 4 premolar extractions with a really negative consequence that you are going to see now in the case. Okay, when she came with this anesthetic, as you can see in the picture, smile with really narrow arcs, with bimaxillary compression, a lot of crowding, and we are going to do a good treatment because we want to, of course, to improve the occlusion and the health of the mouth, but we want also to improve the beautiful smile of the woman, to give her another opportunity to smile and to enjoy her life. Okay, so we're going to see step by step how we did this beautiful change. Well, she came to our office with this terrible situation, with periodontal problems. You can see these big rotations with this big loss of gingiva all over the mouth, with this lack of proportion, these old crowns. For me, it doesn't make sense to have these old treatments. You can see also here the negative torque in the premolars, negative torque in canines and premolars in the lower arc also, and the crossbite here. And something that is really impressive, look at the arc shape in the lower and the upper arc. And as I told you, a big compression, triangular shape. Everything is really, really, really compressed, like the teeth are going out of the bones. Look at this amazing, it's really huge crowding in the upper and also in the lower arc. And as I told you, someone did 4 premolar extraction a few years ago, and even with this premolar extraction we had this huge problem. Well, also because the crowding that we have in the lower arc, we have a moderate loss of bone in the lower incisor, and I like to show it to the patient because I like to show them that with the orthodontic treatment we are not only going to improve a lot the aesthetic, but also we're going to improve a lot the health, and we're going to give her years and life to her mouth. Okay, well, this is the profile with where you can see here the retronatic profile because of the 4 extraction that someone did 4 years ago. Well, 4 years, no, a lot of years ago. And as I always say, please take time before doing the treatment to study the case, to study how is the occlusion, how is the gingiva, how is everything before deciding what is the treatment plan. Okay, and this is the shape that we have, really narrow arc. We have to think about the shape of the arc. We have to think about the torque. We have to think about the propination, the rotation of the molars, many things in order to move from the initial situation to this final situation. So we need to move from here to here. So we have to think what is the sequence of movements that we have to follow in order to achieve this beautiful result. Okay, because it's our responsibility with our patients, and because it's really fantastic working in this way. I can promise you that when I obtain this amazing result, I'm a really happy person. Really happy person. So for me to succeed in this case, the most important are not the attachments. Many of the questions that most of the doctors ask me is, well, Dr. Diego, what attachment I have to use here or here? Well, as I told you always, the attachments is the less important. The most important is what is the treatment plan, of course the first, and then what is the predictable sequence of movement that I have to plan in the clean check to obtain this result. This is the most important. At the end, the attachments, okay? So the treatment plan, well, we can't do extractions, of course. So we have to decide if we are going to do expansion and proclination, or we are going to do expansion, proclination, and IPR. Well, you have to think that if you only do expansion and proclination to obtain the final result, okay, or you are going to do expansion, proclination, and IPR in order to control better the lower incisor. Why I prefer this situation? Because I need overjet, because I have some class 2. Okay, so to solve this class 2, I need overjet in order to let the class 2 elastic to work to solve this problem. Okay, so the second movement is going to be, we're going to do expansion of the arch, the rotate molars. We're going to improve the torque of premolar canines incisors at the same time. Okay, we're going to do it in a no sequence, okay, simultaneous movement of everything. Okay, you can see here that I'm moving all the teeth together. I'm taking advantage of the proclination and the expansion to the rotate and to align everything. Okay, look at here. The system tells me that I have to derotate 62 degrees this canine. 62 degrees. Can you imagine derotate 62 degrees with braces or with Invisalign? So you have to think, okay, I have a really complex derotation. How can I do it? So what you have to do is to take advantage of other movements in order to allow the other movement to derotate the canines to this perfect situation. Okay, so you have to think, how can I do a predictable rotation even in this case that is 2 degrees? Okay, so after that we work with our clean check and everything, and this is the evolution where we plan the clean check in a couple of aligners at the end, not at the end, but when we have passed more than 50% of the treatment. And well, this is the evolution where I'm creating the space. When I see these spaces, I love it because I know that I'm succeeding, because I'm derotating, and now I have space, enough space to complete the rotation. And after 60 months, the final result that we obtain is this beautiful. I love it. I love it. I love it because look at the health of the gum. Look at this stability that we have in the posterior zone. Look at the health of everything. This mouse is saying thank you very much. It's saying thank you very much. And these arches are saying thank you very much because we have given them stability for the future. And of course, we have given them this beautiful smile that I love it. And well, the final results of the X-ray, everything is perfect. It's in stability. Okay, amazing change from here. Amazing change from here to here. Doing everything together. You doing some IPR. And well, this is the evolution from here, this disaster, to here after a bleaching that my sister did. You know, my sister is an amazing doctor working the aesthetics, and she does this beautiful result with the bleaching. How we move from this problem, look at the rotation here, and how we move it to this final position. And the most important for her, it was she was dreaming in a beautiful smile, and after seeing 60 months, we heard the dream of a beautiful smile. So again, another case solved. Just thinking, just doing the things in a predictable way, thinking before acting, and of course then doing, putting all my effort, studying a lot, working all together, me, my staff, everybody who works in this office is working in order to help my patient to achieve this beautiful result. So, well, I hope you enjoyed this case. Again, thank you very much for following my work. Please, if you like it, it will be my pleasure if you share it with your colleagues in order to let them also learn some things about Invisalign. And please leave me your comments, all the questions that you need, and see you next time with another clinical case. Bye bye.